For this video, I'm going to show you how to assess the lumbar spine using something called motion testing, and then from there we can follow on to a very simplistic mobilization technique. So a patient side lying, their legs at 90 degrees like you can see here, and I place their knees onto my thigh, so I'm taking part of their weight, and then I can use myself as a rocking motion to flex and extend his hips, which flexes and extends his spine. Anatomically, PSIS, the posterior superior iliac spine, is in line with S2, and then the iliac crest is in line with L4. So palpate the lower lumbar and just feel for motion, and typically the first level that you feel will be L5 and S1, so they call it the LS, lumbosacral junction, and then naturally you can start palpating high levels and high levels, yeah, and then you can just make your way all the way up, yeah, to the lumbar spine, and then you can almost isolate and just think which one is moving. This one's a bit stiff, okay, as you are coming down through there, okay, around there. Now, just by doing this technique, you are literally treating. So every time I flex, I'm opening and extend, I'm closing the facet joints. But then what you can do is look at this angle. If I do this to his legs and slowly bring his legs down, then this causes a side bending to the left, which is opening the top facets and closing the bottom facets. This right hip is externally rotating, the left hip is internally rotating, so I can use the hip mobility to open the top facets in here. And by lifting his legs the other way, then I'm going to be opening the bottom facets, okay? And again, the legs are reversing their role. So you can almost use the hips to internally, externally rotate to open and close the facets, and you can use that as a lovely little mobilization technique for that lumbar spine. You can do an MET from here. So let's say, for instance, you get the patient to slowly push your legs up, so like this, gently. So as he pushes up, internally rotating right hip, externally rotating left. And as he relaxes up to 10 seconds, we have a window of opportunity, so I can slowly bring his legs down where the tissues are now relaxed, and then that allows me to mobilize the spine more effectively just by using the legs after I've done an MET. So this is quite a nice way of assessing the lumbar and then using the hips to promote mobility at the lower lumbar spine. Thank you for watching.
Hi everybody, this is Dave Sheehan from The Connect Show. I have Raylene Clark with me today to talk about all things pain management and headache and migraine as well. So welcome, Raylene.
Thank you very much, Dave.
Now, Raylene,
Pleasure to be here.
Yeah, and we've we've worked together in capacity of directors for the association in the past. So I've got a little bit of an understanding of what you've been doing, but we really wanted to get you on the show so you could tell the folks at home, you know, what you've been up to, because you are a bit of an academic freak as well. You love academia, so it's really good to hear that. And not everyone has that sort of area of interest. But did you want to just sort of give everyone at home a little bit of background?
Well, without giving away my age, I've been working in this industry since the dinosaurs were roaming the planet. It's been about 30 years now, I'd say. I started out working with Dr. John Whiteside over here. I had the base remedial massage qualification, and I was brought into his clinic to learn all about myofascial pain. And that was from all of the people from America. So Nancy Shaw, who has been on this Connect episode.
Yeah, absolutely.
Tim Sawyer, who taught me the cold spray technique. And then I did that training for about 2.5 years and working with, that was a pain management practice.
Mm-hmm.
After that, then I went off, started my own practice, decided to do a med science degree. So I did that and then finished that, then decided it was time to go and get married and have kids. So I did that. Then started a master in pharmacy, but didn't enjoy that. Had the babies, and then just a couple of years ago, I did the Master of Science in Medicine at the University of Sydney in pain management, specialising in the orofacial pain stream.
All right. Well, do you want to expand on that stream itself?
Well, the University of Sydney Pain Management Masters is that's the pain management stream, but then there's the subspecialty, which is the orofacial pain stream. And so that's in order to get into that, you have to be working clinically in the area of headache and pain management, and you also have to have that undergraduate science degree.
Right.
And it was brilliant. It was brilliant.
And what sort of duration? I mean, how long were you doing that for?
It's 2 years full time.
Wow.
Yeah. And it was.
So you were doing that remotely as well, yes?
Yeah, but you had to be working in the field because you had to have case studies. So you had to have patients that you could use as examples. So at the time I was working at Remedy Wellness Medicine. That's an integrative pain or integrative medical practice here in Perth. And so I had as many patients as I liked there.
Well, that's handy. So how many case studies did you finish up with within the study itself?
Oh, I had to choose one. But with all of the units that you're studying, you have to be able to have daily case studies that you use for each example. So you've got to have them all on tap. So I had that, but then there were 2 final units. One was the headache unit and the other one was the orofacial pain in practice unit. So I had my major case study that I had to present.
Okay. Now let's move on just for a second because I wanted you to touch on the migraine side of things, because it's you see it come and go a lot in the journal that we have with the association. There are articles every now and again that talk about migraine. And what sort of stuff were you doing, or what are you doing now with that as well, which is the important part? So you progressed with what you're studying and what you're doing.
Look, so clinically, I have the same skills as everyone else on this program or who's listening in. So it's trigger point ischemic compression, dry needling. I also have the stretch and spray skill, which is my other side thing. Looking at all of exercises, figuring out if they've actually got a TMJ type problem along with their migraine, but figuring out, and the master's was really good because it taught me how to figure out what sort of headache they've got. So is it a migraine? Is it a cluster headache? There's all different types of headaches, and you have to be able to narrow it down. And a lot of that comes with experience, but a lot of it comes from that learning that I've done. So you can actually figure out what is going on. So that's what the masters did. It sort of filled those big gaps that were missing in knowledge. Okay,
great. And you have done some writing for the journal, for our association journal. So for anyone at home who is interested, if you want to head to our website and go to the journal section of the website, you should be able to search Raylene's work that has been published in the journal itself. What about the future, Raylene? Where are we heading now? Because we've talked about study, kids, work. Is everything tickety-boo there, and we're moving on? Where are we going?
Well, no, very exciting. I'm a 0.6 academic at Endeavour College, so I'm tenured there in the biosciences department, and that's on the back of my med science degree. So I'm loving that. I work at Painless here in Perth. That's a chronic pain clinic, and it's a private clinic. So I'm the gatekeeper therapist there for all the headache patients. So when they come in, they have to see me first, and then if I can't get them better, then they go through to the pain specialists, which is a fantastic thing. But I've also now launched a practice in acute headache and migraine. Now that's a different kettle of fish, because when you're fielding acute headache and migraine, as you can appreciate, you've probably got some people coming in who think they've got a headache or a migraine, but there could be something sinister. So I've joined a practice here in Perth called Medica Health Clinic, and I'm there with GPs. So what we do there is we're bringing in all the acute patients and probably some chronic patients who will then be fed off to Painless. But the ones who have got, say, their acute migraine that's in full flight, they come in, and then working together with the GPs, they can give them like a needle in the bum, which is going to be a migraine abortive type treatment. Or if something comes in that I think looks like they could be brewing a stroke, they're getting all those particular red flags, then I say to the doctors, what do you think? And then they'll
So
go,
it's almost
and
like
then
you're
they'll
playing
do what they need to do.
you're playing a screening role in that, as far as at the clinic itself.
Yeah, so I'm a bit of a gatekeeper in both practices. But when you've got an acute headache practice, if you've got a real acute headache coming in, if it's something serious, then I need that doctor to be there as a backup. Now, at the chronic pain clinic, chronic pain is a very slow-moving entity. And so we don't get acute headache and migraine coming in. They're coming in and I'm looking at their pain almost historically, but not really. They're not presenting with it at the time.
Sure.
I've got that skill set that I can treat both chronic and acute pain. So it made sense to just launch myself into a GP practice where we've got a high turnover of patients and advertise it as an acute headache and migraine clinic with the support of the GPs. And then we can manage all the serious things that are coming in.
Sounds so interesting. And I really congratulate you. It's almost like you found your niche. And I know that as therapists, sometimes we try and broad brush ourselves and try and, treat everyone that we possibly can. But it's so nice to hear that in your case that you've sort of created your specialization through, I guess, your background in education. And now you're applying those specific skills into specific areas.
Well, the thing is, when I first started my training with John Whiteside all those years ago, we had a specialist dentist called Dr. Rob Delcano. And he's an orofacial oral maxillary specialist. So he's a dentist, but he specializes in all of this. I've known Rob for 30 years. And when he said to me one day, we went out to lunch, he said, what are you doing about your masters? And I said, oh, nothing yet. He said, well, do you want to come and do this orofacial pain masters that I've been launching here at University of Sydney? And I said, well, I'll give that a bit of a thought. And after about 5 minutes, I thought, no, that's actually what I'm going to do. So it's having connections throughout industry.
Yeah.
Absolutely. And so we've got alumni group, and it's just, I mean, he created that course. He didn't create it. He created it he can see there's a need in the community for people to be practitioners who have that headache and migraine specialty and be able to determine how much TMJ actually is involved in that headache. Because we've got a lot of practitioners out there who will go and work on the TMJ and the muscles, but then you've got to be able to see how much of that is actually, the jaw related in contrast to, is it a migraine? Is it like a tension type headache? What actually is going on? Because that's only one small part of the whole clinical picture.
Absolutely. Well, it's as I said earlier, it's amazing work that you're doing, Raylene. So it's great to have you on the show today, just to highlight some of the things that you're doing in clinic, and wish you all the best for the future with it. And hopefully we'll get a chance to see some more writing and published through the journal that you're doing at the moment too. So many thanks.
Yeah, I'm always
yeah, absolutely. For the folks at home, thanks very much for tuning in today with Raylene Clark, and we're going to see you next time. Bye-bye.